Hey guys, so today we are going to be taking some notes and looking at policy in the United States, specifically domestic policy, policy happening within the US borders, as well as the people within the borders of the US, looking at social welfare, healthcare, the environment, and energy. So first our question is, what is social policy? And social policy actually stems it's right there in the Constitution, right there in the preamble, which says, "We, the people of the United States, in order to create a more perfect union, establish justice, promote the general welfare, do ordain and establish this Constitution." But the question that has arisen is, what is the government's role? What is the government's responsibility to the welfare of its citizens? And this idea has changed over time and remains controversial today. And specifically, we see a divide in our policies of social welfare, healthcare, education, environment, really split and divided along ideological lines. So I want to talk about first social welfare policies. And social welfare policies specifically are these programs that provide support and assistance to specific groups of people, whether that's the elderly, the disabled, those in need, families with needy children, for example. And this is where a lot of the controversy comes in, right? Because when we're talking about welfare, right? I mean, think about what that word means to you. Even though it comes right out of the preamble, that phrase often conjures images of irresponsible recipients who might be taking advantage of those welfare payments from the government instead of working. In truth, a lot of Americans do receive, at least at some point, benefits from the government in terms of welfare. And I think it's important to note the distinctions between social welfare policies in our country. So we have first entitlements. Entitlements are programs like unemployment insurance, disaster relief, disability payments that provide benefits to all eligible citizens, key all, regardless of need. That would be, for example, Social Security. Then we have the means-tested programs, and this is where a lot of the controversy comes in. These means-tested programs are things like Medicaid, actual welfare, under which applicants must meet eligibility requirements based on need. So you have to qualify for these programs because you make below a certain amount in income, for example. Now, I think it goes without saying that social welfare policies are expensive because we're helping to support those all who qualify through Social Security, for example, or those who are in need. And it's also important to note, as I've mentioned, that the controversy stems from how much do people get, to what degree, how do they earn it, right? So for example, when we're looking at policies like Medicare, Medicaid, food stamps, we see a lot of these ideological divisions, right? Conservatives tend to believe that these means-tested programs discourage people from working. Liberals are more likely to see the programs as helping people weather those difficult circumstances, right? So we look at how do we decide who gets what in our country? And it's important to consider the biggest social welfare program, that entitlement program, Social Security. Now, historically, family welfare was a private concern beyond the scope of government. But we turn to the New Deal, there's FDR, where a lot of our government policies take root. And the Social Security Act of 1935 was passed as a part of the New Deal to deal with the Great Depression, establish a safety net for less fortunate Americans. Beneficiaries are retired or disabled people and surviving members of their families. It's funded through payroll taxes on employees and employers. I think it's important to talk about, because this is a current issue, the living on borrowed time concept of Social Security. So what we have here is a chart showing us this trust fund, wherever the money goes that is collected by Social Security taxes. Now, this problem that we are facing today can be stemmed from, wait for it, the baby boom. Thanks, boomers. So ultimately, right, I mean, FDR couldn't predict this, but after World War II, we had a huge spike in population. And now what we're seeing is, as those people are now retiring between the years of 2010 and 2030, we have a huge number of recipients who are retired living off or gaining Social Security benefits. Now, that might not be so much of an issue. However, now in 2020, our life expectancy is longer. So not only has the number of workers growing, has that slowed down, right? We're not in a baby boom anymore, but the number of recipients who are retired are growing, and they're staying alive longer to continue receiving these benefits. So this is depleting that trust fund. And as you can see here, the newest report estimates that the trust fund may be depleted by 2033. So this is an issue that we might see, some reform and policies in our lifetime, because there's a very good chance you and I might never receive what is a traditional Social Security check because of this depletion being faster than anticipated. Now, the newest issue facing the welfare policy issue is the idea of a UBI, or universal basic income. Should we or should we not have everyone in the country over the age of 18 receive a certain amount of money a month? This is an idea being proposed by quite a few candidates in the 2020 election. We don't need to know too many specifics, but I do think it's something important enough to mention, at least in social welfare. Now, let's talk about education. As we learned with federalism, states and local governments deal with education, but the federal government has a role. Today, most federal funds go to higher education in the form of student loans and grants. And in the 1950s, we saw the government extend its hand into public education, grades 1 through 12, particularly for STEM programs, science, technology, engineering, and math, right? Cold War. We were competing against Russia. We wanted to prove that we were the best in all of these science and math fields, to get to space first, to make the best weapon. And then also in the past, in 2001, under President Bush, we have No Child Left Behind, where standards were set, schedules for testing were set. The program has been controversial because it's imposed unfunded mandates, which, if you remember, are those requirements by states to meet federal guidelines unless they would like to receive consequences, whether fines or withholding of funds. However, the government today funds less than 10% of the total amount spent on education, but that doesn't mean it's completely out of the realm. Now, healthcare is another controversial issue that has been talked about a lot recently, specifically with this idea of national health insurance, or universal health care. And that has been really pushed recently by this guy, Bernie Sanders, starting in 2016. But Harry Truman was the first president to start pushing for a national health care program. And just some quick things on the healthcare in the United States. We spend $2.5 trillion a year on healthcare. And this is so high because new technologies add to cost, right? The better the healthcare, the more expensive it's going to be. And in our country, no one person, group, entity has primary responsibility for payment or control of the cost. We also see inequalities in access to healthcare. You gain coverage to healthcare, getting it through your employer, right? Your employer will purchase you a health insurance plan. You can buy individual plans, but they're more expensive. And what we see is small businesses are not offering these programs to their employees because they're too expensive for them to purchase. So people have unequal access to quality healthcare in our country. Now, the government does play a role in healthcare through Medicare and Medicaid. Medicare is an extension of Social Security tacked on later as part of that entitlement program, specifically caring for the elderly, those retired. And then Medicaid is one of those means-tested programs for those who are economically disadvantaged, who have to prove that they are below a certain income level to receive medical benefits. It's also important to talk about Obamacare when we look at how this has impacted healthcare. It's also known as the Patient Protection and Affordable Care Act. It was designed to extend health insurance coverage to millions of uninsured Americans. It also prevented insurance companies from denying coverage due to pre-existing conditions and requires plans to cover a list of essential health benefits and preventative care like mammograms and yearly physicals. Now, for medical research and regulation of food and drugs, the government also has a role in this. Whether it's gathering information, monitoring healthcare, the FDA of the bureaucracy labels, processes foods, drugs, cosmetics, the Center for Disease Control monitors global health even and health within the United States. So they're responsible for, this whole new coronavirus issue that's coming out. Alerting the public on that, regulating vaccines. And then finally, we move to the environment and energy. So we again trace history back to the 1960s and 70s under President Nixon, forming the EPA. And this EPA is that largest regulatory agency looking at pollution, pesticides, radiation, waste. And as we know, as they're a regulatory agency, they're responsible for monitoring compliance to those regulations. One of the other things that the EPA does is require environmental impact statements whenever a new project is proposed, whether that's building a post office, widening the road, right? Any sort of building. An impact statement, an investigation has to be done to see how the environment would be impacted by that development. Right? We've talked about the Clean Air and Water Acts, so I'm not going to talk about those too much, but these are those acts that the EPA has to monitor for compliance. The EPA also monitors the endangered species in our country and around the world, looking at those that are on the threatened and vulnerable list to make sure they don't become extinct. The EPA also taxes chemical companies to create what's called the Superfund to deal with wastes produced by these companies in case there is a spill that needs cleaned up. And it also addresses global warming. Now, for energy is coordinated by the Department of Energy really created in the 1970s in the wake of the worldwide oil and gas shortages. And the major concern today is maintaining a supply of cheap energy that we depend on for our activities, right? We have a dependence on Middle Eastern oil. We're also keeping a watchful eye on depletion of natural resources, damage to the environment. So our biggest goal are renewable and sustainable resources, whether that's wind, solar energy, right? We want to make sure it's sustainable. Okay, so that concludes this part on domestic policy. Next, we're going to be taking a look at economic policy in terms of on the domestic side of things. So stay tuned for that video, and I will see you guys in class. Bye.